welcome to our latest episode of the Technocrats.
Welcoming everybody to Revolutionizing OR Efficiency with Hartford HealthCare and Griffin Health. So we're going to have a great show today, guys, and we're going to dig deep into some of the transformation that they've had in their ORs. So I'm looking forward to that. I'm your moderator, Lawrence O'Toole. I'm the CEO and co-founder of LJO Advisors, where we work directly with hospital systems and advanced technology companies such as Medtel and NextGen event in the marketplace, bringing best solutions to our end customers. Before we jump in, I just want to set the table real quick with some of the logistics. You're all going to be muted throughout the event itself. I want to give you some insights to what the state is here when it comes to OR and OR efficiencies, et cetera. So right now in the United States, surgical cancellations continue to be a major challenge for the healthcare efficiency and financial stability. Studies have shown that approximately 14% of elective surgeries are canceled on the scheduled day, with a substantial portion due to administrative or structural issues. These last-minute cancellations not only disrupt patient care, but can also lead to considerable financial losses. For an example, during the early months of the pandemic, hospitals experienced a loss exceeding $20 billion in revenue due to the suspension of the elective surgery procedures that were out there. And that just gives you a real good snapshot, just like how big an impact financially and actually patient health surgical procedures have in the marketplace today. But even post-pandemics, surgical cancellations remain a significant burden in our industry. Recent studies indicate that cancellation rates have surged in some healthcare systems due to ongoing staffing shortages, increased administrative complexity, and inefficiencies in scheduled workflows. These cancellations cost an estimated $4,800 to $8,000 per unused operating room hour, putting further financial strain on healthcare organizations. But today we're privileged to have Andrew from Hartford HealthCare and Kim from Griffin Health, who will share how their organizations have tackled these challenges and transformed OR inefficiencies into strengths by using Medtel's solution. Their insights will highlight how modern technology can enhance surgical scheduling, reduce cancellations, and improve overall patient care. Additionally, we have a couple of special guests to help us out here too. So we're fortunate to hear from Harold, the CEO of Medtel, and Deepak, the CEO of NextGen event, who will discuss the role of technology in the OR, but also as it pertains to the future of healthcare innovation. Their expertise will provide valuable insights on how digital solutions are reshaping surgical efficiency, not inefficiencies, and improving outcomes across the industry. So please join me in welcoming Andrew, Kim, Harold, and Deepak. So we should have a nice conversation here. So I want to start with you, Andrew. Can you start by introducing yourself and sharing your role at Hartford HealthCare and key, especially as it relates to the OR operations?
No problem. Thank you. Appreciate you having me today. My name is Andrew Turczak. I'm the Vice President of the Connecticut Orthopaedic Institute at both Midstate Medical Center and St. Vincent's Medical Center as part of Hartford HealthCare. I've been in this role for 3 years. I served as the Executive Director of Perioperative Services at St. Vincent's for 2 years and have been with Hartford HealthCare for the last 7 years.
Excellent. And Kim, same question to you. Can you start by introducing yourself and sharing your role at Griffin Health?
Hi, I'm Kim Viadero. I'm the Administrator for Surgical Services and the GI Department at Griffin. I've been there for 18 years, and before that, I was within the Yale New Haven system for another 18.
Excellent. And Harold, tell us a bit about Medtel and the mission behind your solution.
Well, Lawrence and Deepak, thank you for facilitating today's discussion. It's an honor to be on this panel of distinguished experts, so I really appreciate that. And Kim and Andrew, it's been a pleasure collaborating with both of you. It's been exciting to watch both of your organizations flourish through our collaboration. So as those on this call know, surgical case coordination spans multiple stakeholders, right? And we know that the process typically happens outside of the core systems, whether it's spreadsheets, phone calls, or emails, and unfortunately the result is gaps in visibility, communication, which typically lead to errors, delays, and then also rising costs. So in response, our team is focused on tackling the associated challenges with care coordination. So Medtel's mission, essentially our mission, is to improve surgical outcomes and experiences for patients as well as their providers through tech-enabled services.
Excellent. Thank you for that background. And Deepak, can you start by introducing yourself and sharing your role at NextGen event, and also give us a little bit of the mission behind your services?
Sure. My name is Deepak Mittal, and I'm the CEO of NextGen Invent. My expertise is actually in transforming organizations into AI-enabled organizations. I've been technology advisors for various companies, helping them to grow from a startup to unicorn or achieving successful exit. I have been also member of board of directors for various companies. Currently, actually, in the member of board of directors for Columbia Business School Alum Club of New York and CMR Institute. And I also heads up Columbia Business School Alum Club think tank panel for healthcare executives, which basically brings the CIO, CEO, and CMOs of large healthcare organizations to discuss the industry challenges. When it comes to the NextGen Invent, our mission is to bring the new products and services to market and drive the innovation through AI and advanced technologies. We have a proven track record of actually architecting and deploying 500 plus AI models and more than 100 SaaS products to the market.
Excellent. Wow. As everybody can see, we have a depth of great experience on the line. I'm looking forward to diving right in. So, Andrew, I'm going to start with you. So I know that you guys are on Epic right now, but what specific challenges did Hartford HealthCare face in achieving OR efficiency before implementing the Medtel solution?
So specifically, when we were developing the Connecticut Orthopaedic Institute, we work with a significant amount of private practices out in the community. And one of the challenges were that everybody was on different EMRs at that time. We were getting cases booked through the old-fashioned fax machines. There was inconsistent standardization of scheduling processes. And we were really looking for an opportunity to be able to streamline across the entire spectrum the process for scheduling cases, the process for paperwork transfer, and for us to overall improve the efficiency in our pre-surgical phase of care, to be able to improve the day of surgery preoperative experience for our patients, as well as to help reduce same-day cancellations and ensure that we are prepared for a successful outcome for our patients while delivering an exceptional experience.
Excellent. So it gives a good starting point from where you were. And the same to you, Kim. So I know that Griffin has been a long time Meditech customer. For those who don't know, I used to be an executive at Meditech, and I've actually visited your institution many times. But I have the same question for you. Like, what specific challenges did Griffin Health face in achieving OR efficiency before implementing the Medtel solution?
Well, just as Andrew said, we relied on fax booking forms, which caused us huge delays because our fax machines were going down frequently. They were breaking because of the high demand and usage. We do over 6,300 cases a year. Our quality of the print lines were squished. Pages would be oriented instead of portrait. They would come across as landscape. EKGs came over dark and unreadable. Pages were missing. Other pages were getting mixed in with other patient faxes. We didn't know when cases were booked, when faxes didn't come over. So this left pre-admission testing, our schedulers, and everybody scrambling at the last minute to get patients prepared for surgery, which caused delays and cancellations.
Gotcha. Seems to be a very common story across the landscape. So, Harold, you sit in a very unique position because you're partnering with a lot of health systems out there, and you just heard both from Andrew and from Kim on specific challenges they have. But what other challenges have you guys seen that other health systems are having out there in the marketplace?
Well, we see quite a few gaps despite investments in electronic health records and other systems. Essentially, every case has its own distinct clinical, financial, and operational profile. And that's a struggle, I think, for patients and their providers throughout each organization. And what I would say, Larry, is that we see a lack of sustained compliance to somewhat best practices, whether it's through payer rules, whether it's through clinical guidelines. Unfortunately, despite all the care coordination and the meetings that happen, we find that there's quite a bit of disparate systems and a lack of synchronization, not only through team members, but also through their systems.
Gotcha. Yeah, there's just a plethora of issues that are out there. And glad that your platform can definitely help there. So Andrew, I'm going to go back to you, and I'm curious, can you share the process of like how you ultimately decided to implement Medtel? I mean, what was the crux for that?
Yeah, well, I mean, ultimately, when we identified that problem and really trying to get ahead of it, and utilize technology to support, our pain points that we were experiencing, we ultimately ended up really starting to research. We did vet a few companies back then, and if I'm not mistaken, I think this was all the way back already in 2018 when we initially started our engagement. And we vetted a couple companies, and one thing that really stood out with Medtel was the different opportunities that were there beyond just potentially solving the issue about how to schedule a case. We were really impressed by the ability, obviously, to use a cloud-based platform that we can use throughout for all surgeries and for all of our practices to be able to schedule cases with us. We really like the ability to transfer the pre-admission paperwork that, back then was, very much still coming from the primary care providers to the offices. We needed a lot of paperwork to be getting into our system to ensure that from regulatory compliance and obviously ensuring that, we were ready for surgery itself that was in there. But then it went beyond that. One of the key components that was really interesting was by using this cloud-based platform, when you booked a case, it was able to actually then also send a message to our vendors. And our vendors then, through an app, had to acknowledge the case and that there would be improved communication between our sterile processing department and our vendors to ensure that we were getting equipment early, but also to hold accountability in ensuring that the equipment and implants were there on time and or early. And then also from a pickup perspective, it really created a streamlined communication pathway. But this also wasn't just going to just the scheduling office. The fact that this cloud-based platform was able to provide communication to our perioperative leaders, our schedulers, our pre-admission testing center, our vendors, SPD, everyone was on the same page. And we thought that that was something that did differentiate for us to be able to really elevate and to create sizable efficiencies and preparedness on our front. So ultimately, it was a combination of those things, and then we can talk about it later on, even additional components from a cost savings perspective and being able to really be able to help curtail excessive costs on our front. There are other avenues that we were interested in, but wasn't the primary focus up front. Primarily, what I stated just now, those were the main components that we ended up moving forward with Medtel at that time.
Gotcha. And some of the issues that you just highlighted with the communication gets even more intensified, if you will, or more exponential when you're talking about having multiple different platforms that some health systems have. So just thinking that you're still on a single EHR platform, but you still have a lot of other systems that are plugged in and a lot of moving parts, right? So it's a very complex process. And I know, Kim, you and Griffin Health have had a different pathway there, and so the different challenges. So I have the same question for you, but can you share like the decision-making process and what ultimately kind of pushed you to move forward with implementing the platform?
Well, it's very similar to Andrew. I mean, our fax machines were breaking daily, and it got to the point where they were down for 2+ hours at a time, which really increased our case cancellation rate, which we had angry surgeons, we had upset patients, staff was upset because they felt like they weren't doing the best job that they could do. So as Andrew said, we vetted out other companies and found that the SurgiScript was our best option because of the cloud-based option. And our IT department was busy with other projects. And we actually went live 5 weeks sooner than
Oh, wow.
the agreed upon go live date.
That's unheard of. You never find getting ahead of schedule. It's almost everything's slips and goes behind schedule. So that's thank you for that comment. That's great.
And also, it also pulled in our insurance verification department. It also pulled in more departments because we have seen that cases that were inpatient only CMS codes may have been falling through the cracks. So our insurance verifiers were pulled in and they have a dashboard, and it really pulled the whole thing together seamlessly.
Okay. So for the CMS inpatient rule that you were talking about, is that something that the system does for you automatically, built-in rules?
Yes. Everybody, the insurance verifiers, our schedulers, our pre-admission testing department, they all see a dashboard. And also the surgical offices see it when they're booking a case. So they know if it's a CMS inpatient only code that the case has to be booked that way. It flags them. Where we have had cases that fell through the cracks that weren't booked correctly. And unfortunately, we were not reimbursed for those cases, even after we appealed them.
Wow.
So this is a huge cost savings.
Gotcha. And let's pull on that thread a little bit and let's move into kind of post implementation. So now that you've been leveraging the system for a while, you have these various departments that are all on the same platform, that are all contributing to one single thread of communication. What do you key in on as sort of the most impactful changes that you have observed in the OR workflows and post implementation?
Is that directed at Kim or?
That's Kim. Kim, yes. Yeah,
I'm sorry. We're now getting documents in their entirety. They're legible. They're no longer handwritten. The schedulers could pull it up at different computers. They no longer have to be in their scheduling office next to a fax machine. The same thing with the pre-admission testing nurses. We're saving on reams and reams of paper. Our booking forms on offices would fax a booking. We may not know until maybe the day before, and because our schedulers send out the final schedule the day before to be finalized. Offices would call back and say, well, but we have a case with Dr. So-and-so. And it would be, well, we didn't get the fax. So last minute scrambling and everything. Now, as soon as the case is booked, we see it immediately. It's made the scheduling experience much easier. Our schedulers, our pre-admission testing department, they're no longer on the phones with offices. It's really saved a lot of time for everyone. Their time is now focused on interviewing patients and getting the patient optimized for surgery. So prior to Medtel and the SurgiScript implementation, unfortunately, we were only 24 hours out for patients being optimized for surgery. Now, I'm happy to say we're 5 to 7 days out prior to surgery.
Wow, that's quite the improvement. Harold, what have you observed from your seat?
Yeah, no, it's great. As I was saying earlier, every case has its own distinct clinical and financial, and then also operational profile. So like Kim and Andrew are mentioning, we're able to embed their guidelines and match them against a patient-specific profile so that patients end up in the optimal care setting. And that's done early in the process, right? That whole care management piece happens very much proactively rather than retrospectively or being reactionary. And the goal really is to ensure that when that patient enters the operating room, there's no surprises.
Yeah, most of the time surprises aren't good surprises.
So each stakeholder, for example, and I heard about prior auth, but each stakeholder, and I'll use prior authorization as a good example, is able to leverage our robust rules engine to ensure that there's adherence to payer rules and the guidelines. It could be anesthesia, for example, has the critical clinical details that they need before the case,
right? So
that they're not surprised by the way the patient looks. And in some instances, whether it's an operational piece like supply chain, they're able to better manage whether it's their value analysis process or even drive sustained compliance to implant utilization.
Gotcha. Thank you. So I'm going to go back to Andrew. So Andrew, going back to the question that I had for Kim, were there additional impactful changes that you've observed so far in the OR workflows since you've been on Medtel? Did you find some of the same things that Griffin found?
Yeah, I mean, certainly, can validate everything Kim said. We saw some similar things. I think same-day cancellation rate went down to less than 1%. That was huge. Our first case on-time start has gone significantly up. Our PAT preparedness, paperwork preparedness, consents being, validated and present. But if for some reason a consent's missing from the actual chart, you're able to pull up Medtel and pull directly out of there as well. Anyone from the frontline staff is able to do that. I think another big piece, as I spoke to previously, vendor drop-off for trays and implants was, 12 hours. I mean, if we got it at 6 p.m. to be ready for 6 a.m. or 6 a.m., that was a good day. With the ability to really utilize this tool to hold parties accountable, we have really raised that to 24 to 48 hours. We are now having implants and or instrumentation coming in, and we are aware of delays, and there's two-way communication. The other piece of it is that leveraging technology, it has decreased the amount of actual phone calls between offices and surgical schedules and OR, because this is a two-way communication tool as well. And that really has saved time, as what Kim said, to really be able to focus on the patient themselves and ensuring that they're optimized for their care. And lastly is the insurance verification component. The fact that we are able to now align our insurance verification team and actually have access to Medtel as well, from a prior auth and denial standpoint, have been able to decrease that because we are really able to work that through ahead of time versus either day of or retroactively. So all those components, certainly not all and only because of Medtel, but Medtel has played a big role in helping us achieve those goals.
Yeah, and like anything else, it gives you an opportunity when you're implementing new technology to really take a look at the other workflows that surround that, And it sounds like you guys did a really good job of not only implementing Medtel in an optimized way, but also being able to look at the other opportunities that you have when you're doing the shift, right? Which I think is excellent. I want to get Deepak involved here a bit. We've been talking about some different technologies, and I want to get his insights. So Deepak, when you're looking at the OR and clinical space, what do you see as game-changing technology that can be used and leveraged in the OR space to gain additional efficiencies? It's a broad question, I know.
Yes, good question. And what I'm actually hearing is that fax machine is actually the competitor to the automation world. But actually, the technology and AI is fundamentally here to solve business problems and to be able to optimize the clinical, financial, and operational workflows. And I think AI has been doing that, as others have said, by tackling the OR pain points, whether it is vendor mess, whether patient not show up, or actually delays in the product availability and things like that, by predicting or actually taking an action so that issue doesn't actually occur itself. At the same time, to your question, Lawrence, is that the computer vision and generative AI has come a long way now. For example, if you take one of the solutions which we built, you can actually take a picture of surgical tray, and it will tell you that what are actually the different equipments are there in that tray. So you actually know, the staff actually know that it is all the equipments which are needed for the surgery are actually there. Or you can actually take a picture later on so that you know that all the equipments are actually going back to the inventory department as well. Means this is not only improving the efficiency, but in my opinion, it is actually improving the compliance and patient safety also. And if you talk about the generative AI, it has come a long way from in the past 2 years. Now it is actually helping in taking critical life and death decisions also. one of the example I can say is that building the HealthCare OR Copilot, which can take the guidelines, the standard operating procedures, emails, which may have gone back and forth with vendors and things like that, and tell actually the staff answer to every question through a speech-enabled, HIPAA compliant chatbot, means the Copilot itself. And by having that information on the fingertips is actually a game changer. And at the same time, the same Copilot, just think about having access to that to the patient. They can actually ask the question: is that what are the precautions they should take? What are the things they should do before they actually reach to the hospital? Or what might be the recovery time? So all that time, all that information is actually can be made available through that. So these new technologies are going to change the game, going to make operations more efficient and help in the overall that patient healthcare outcomes actually improve.